Hi guys, it's Dr. Michelle Henry. I'm a board certified dermatologist in Manhattan, New York. And in my practice, I do everything from general dermatology and acne to skin cancer surgery to cosmetic procedures. And so I'm super happy to be here with you guys to talk about hyperpigmentation. Hyperpigmentation is one of the top concerns I see in my office, especially in my women of color. So in skin of color, we have more melanin. We all know that. That's what makes skin of color beautiful. That's what protects it from the sun in many ways. That's the glory of having skin of color. That melanin also is what causes more hyperpigmentation. So in our skin, we have little bags of melanin called melanosomes. And in skin of color, they're very, very packed. They're full of pigment. So anything that interrupts that, anything that bumps those melanosomes, any slight inflammation will cause them to leak. And that's why we're significantly more prone to having hyperpigmentation. I know a lot of you will say, sometimes I feel like if there's a strong wind, I get hyperpigmentation. Anything can cause it. Acne, trauma, any sorts of trauma, rubbing, a small scratch, which is really, really tough. And so there are lots of treatments, and that's what we'll talk about today. So with hyperpigmentation, one of the most common causes I see in my office is from acne. So every time we have an acne cyst, we have inflammation. And that inflammation causes that pigment to leak out, and there we are, we have dark spots. Another really common reason for hyperpigmentation or dark spots on the face in my patient population is something called melasma. If you Google melasma, they call it the mask of pregnancy, and that's because hormones really trigger melasma. And what you see with melasma are dark patches often on the central face, on the cheeks, on the nose, above the lip. You can see them after having children. You can see them with birth control. So anything that's going to manipulate your hormones in any way can cause melasma. The treatments for both are similar in some ways and different in others, and I'll kind of go down that path and tell you what we do. So in general with hyperpigmentation, when we're trying to lighten it, there are a number of topical treatments that we can use. So we'll go through some ingredients that you can look for. So hydroquinone, everyone's heard of hydroquinone. It's the number one ingredient in most fade creams. We've used it forever. There's a little bit of controversy about hydroquinone. Some are concerned that it can actually cause cancer. So what we see in mice in the lab, if they eat hydroquinone, then it can be a carcinogen. But the mice are eating 3 or 4 times their body weight in hydroquinone. So as long as you're not doing that, you're fine to use hydroquinone for a short period of time. So typically in my office, I'll use it for 2 to 4 months maximum, and then I try to use something else. So other ingredients that we look for. So things like retinol. So retinol and retinoids, we know that they help to exfoliate the skin. In exfoliating the skin, they gently lighten the skin. Glycolic acid also works similarly, so it will gently lighten the skin. Other things like kojic acid. So kojic acid is a mushroom extract, and that helps to slowly lighten the skin. Licorice helps to lighten the skin. Soy helps to lighten the skin. Another ingredient called arbutin helps to gently lighten the skin. Azelaic acid is another ingredient you can look for. And something we've all heard of, vitamin C. So vitamin C also helps to gently lighten the skin with time. What's really important to know is that no matter what you're using topically to lighten the skin, we really need to make sure you're using good sun protection. So especially with retinol, it's really important. But with anything that's lightening your skin, if you don't use sun protection, it's going to cause that pigment to come back and to rebound. So when we're looking for a sunscreen, we want a broad spectrum sunscreen, something that protects against UVB and UVA. There are a lot of really elegant sunscreens nowadays, so you want to go out, it comes in lotions, creams, sprays, powders, primers. So really go out there, there's something for brown skin. So I wear sunscreen every day, I do not look chalky, so it's really important to find something that works for you, that you can stick to and commit to. So after we've used creams, if we've exhausted creams and we're still not seeing improvement, then we go up to the next level. So the next level will be to do something like chemical peels. But before I go to chemical peels, there's 2 more creams I want to mention. So tranexamic acid is a brand new topical that we're using that's been used in Asia forever. It's a favorite in Asia, and now we're using it here, very popular. Another new cream is called cysteamine. So cysteamine, similar to hydroquinone, it's very, very effective. It's short contact, so we don't leave it on the skin long term. We put it on and we wash it off. But the efficacy is good, so it's working just about as well as hydroquinone. So it's another favorite of mine is cysteamine. So now on to the next step. So when you come to my office, what would I do? So chemical peels. So again, chemical peels are going to exfoliate the skin. It's a little bit deeper than we see with topicals. So in exfoliating that superficial skin, we're also getting rid of some of that pigment. So depending on your skin type and depending on your concern, I will use chemical peels. Chemical peels are absolutely my first kind of more aggressive step with melasma, because melasma is very persnickety. So melasma is difficult, it's fussy, and sometimes even heat will flare melasma, and especially lasers can flare melasma. So I use lasers in melasma, but that's if a patient has failed creams and peels. Pigment from acne or hyperpigmentation in general is usually not as difficult to treat as melasma. Melasma is much more difficult to treat. So if we've used the peels and we're still not seeing improvement, then we graduate to trying a laser. So some of the lasers that I use the clear and brilliant laser, I use the Aerolase laser. In patients, if their skin type can't handle it, I will use the Fraxel laser. So all of these lasers help to increase the absorption of tranexamic acid. I will put topical tranexamic acid on. It helps to increase that absorption. If I'm not using something on top of the laser itself will help get rid of pigment. So the lasers create little channels in the skin. Some of them create little channels in the skin, and in those little channels, they then extrude the pigment. And that's how the lasers work to help reduce that. The lasers also help to suppress how intensely we make pigment in the skin. So those are some of my favorite treatments. And last, if none of this is working, I will try an oral medication. So tranexamic acid also comes in an oral form. And that oral form is quite effective at reducing pigment in cases that have proven to be really, really tough. So we have a huge toolkit when it comes to treating hyperpigmentation. The key is commitment. It is a long process, so I always tell my patients we're holding hands, we're going to get there. Commit to a few months to really see improvement. Make sure you use your sunscreen, because if we're not using sunscreen, we can lose all of our results. And then protect your skin. So whatever you have to do to protect your skin from causing that hyperpigmentation. So treat your acne early. Again, make sure you're wearing your sunscreen. And with melasma, there's a familial component. So if you know that your mom has melasma, or your sister, or we see it in men even sometimes, you see this melasma, make sure that you prepare for it. So if you're going to be going on birth control, that's something to think about. So thank you guys for tuning into Ask Dr. Henry. I hope that you got some tips to help you prevent hyperpigmentation and treat any hyperpigmentation that you have. If you have any additional questions, you can always find me at Dr. Michelle Henry on Instagram, and I'll try to answer all of them on the next Ask Dr. Henry.